Welcome to Menopause the Positive Way, the podcast that inclusively supports Women Plus moving through their menopause journey with greater ease, control, and an empowered mindset. You can subscribe to this series wherever you get your podcasts. Brought to you by Positive Health, making life easier and helping you make a change for the better.
Welcome, podcast listeners, to Menopause the Positive Way, where today I'm absolutely thrilled to have Brenda Navin, who's a registered dietitian and the CEO and founder of Launch My Health, a fabulous company focused on food as medicine and nutrition, which is a very important area of focus for women who are on the menopause journey. Welcome, Brenda, and thanks so much for agreeing to be a podcast guest.
Thank you. I'm happy to be here.
So, Brenda, why don't you start off by telling us a little bit about you, how you were drawn to being an RD, and what prompted you to start a company around nutrition?
Yeah, so I have always had I would say almost like this passion for nutrition. I grew up with a mom who was cooking from scratch every day, and I was in the kitchen with her all the time. And, I didn't know what I was kind of building in myself at that time, and got to college and knew I wanted to go into healthcare, but nutrition just kind of ended up being that calling, and immediately was excited to work in healthcare and started working in a hospital. And I think within 6 months, I was like, what did I do with my career? This is not what I thought nutrition was. And I felt like I was working in a revolving door at the hospital. I was an inpatient dietitian. And I think that was just this pivotal moment where I knew I had to do something that was more about prevention and helping people get nutrition into their homes and into their lives, their daily lives, and not just be it kind of this reactive kind of thing that people, once they got sick, they had to do something. And most of them didn't want to listen to me. Even I would be educating patients and they didn't want anything to do with what I was saying. So I was able to start working on prevention in the healthcare system and started a program where I worked, grew it over the course of years. We ended up getting a beautiful new facility and really developed this holistic model, integrated it into the healthcare system. And then COVID hit, and it was always a challenge to really just bring nutrition to the forefront. Mm-hmm. But COVID made it much more difficult. And it really, I guess, put a spotlight for me on the fact that I needed to do something different. And I knew I had a way that I could bring nutrition to the masses. And so that's what I set out to do with Launch My Health. So we started in 2020 and just celebrated our 5-year anniversary. Really excited about that. And our goal really is to bring cooking skills and clinical nutrition to everyone, no matter who they are, where they live, what they do, and make it applicable and easy for them to implement so that nutrition isn't the barrier to their health.
Well, congratulations on your 5-year anniversary. That is a major, major accomplishment. So kudos to you and your team.
Thank you.
So why don't we jump right in? I think that people are starting to recognize the power of food and the impact of what they put in their mouth is. And it becomes, I think, an intensified area of interest for people who are on the menopause journey. So can you talk a little bit about how nutrition can be used to make a difference as people are going through the hormonal transition, both in terms of the symptoms they may have, as well as reducing the risk or mitigating the impact of chronic conditions like diabetes, hypertension, heart disease, high cholesterol, the risk of which increases by virtue of just the drop in estrogen levels during the journey.
Right. And I think, I mean, this is like opening Pandora's box. I mean, we could probably talk for several hours. And I know you and I have talked
Yep.
at length about some of these things. And I think for women, this is probably one of the most frustrating periods of their life. I know for me, I am postmenopausal myself. Always been somebody who's taken really good care of myself. And I felt like I went off a cliff when I went through menopause. And I was wondering what the heck is happening. I mean, I had
Mhm.
worked for years talking to women about complaining about weight gain in their abdomen. I'm like, I don't know that I necessarily believed it. Well, once I hit menopause, I totally understood what they were going. I'm like, yes, this is real, right?
Yes.
So it's been humbling, and it's also made me really dig into the reasons why and learn more about women's health. And I think what women need to know about nutrition is that it can make a difference, and it's probably one of those powerful tools they have in their control to make a difference as they go through this transition and even preparing for the transition too. And estrogen, you and I both know that there's receptor cells all over our body for estrogen.
Mhm.
And so estrogen impacts every single part of our body. So does nutrition. And nutrition bathes every cell. So if we can help every cell in our body function better, because that drop in estrogen, I think the three things I think about most that women complain about is their metabolic health, right? And they complain of weight gain. We have more visceral fat, or that fat that's in and around our organs that is dangerous. And that's how we get the heart disease. That's how we have high cholesterol and all of the other symptoms that come along with that. And then I also think about bone health and how that can really impact someone's life as they age and really degrade their quality of life if they start having fractures and not being able to do the things that they want to do. And the other thing that I think about, lastly, with nutrition is muscle preservation and how
Mhm.
we need to be, one, exercising with strength training, but we need to have adequate protein to do that too. So if I were to advise someone, what kind of things would you focus on? Those would be my top three areas as somebody's, entering that menopause transition and even preparing for it too.
Okay. And I think that people may not be aware of the impact of food and what they are also drinking can have on and the link to certain symptoms. So can you just give a few examples of things that may trigger some of the common symptoms of the menopause journey?
Are you thinking of things like hot flashes, perhaps?
Exactly.
Yeah. So that, for me, that's been one of my most significant symptoms of menopause and struggle with that. Of course, doing hormone replacement has significantly helped with that. But I also have a lot of triggers, and every woman can be different as to what their triggers
Hmm.
might be. But the common ones would be alcohol, in particular, red wine usually will be a huge trigger, sometimes even white wine. Or any alcohol too. And people will report more hot flashes and also insomnia from that. Also, spicy food, maybe really hot food. So, really working with what those triggers might be for yourself. Another one, common one, is caffeine.
Hmm.
So, I recommend that people take, a food log, whether it's digital, a piece of paper, whatever's going to work for you, whatever's simple, and try to figure out if there's any type of pattern, whether it be food or maybe part of your lifestyle too. And remember, they can be a little bit of delayed reactions too.
Well, and I'm glad that you brought that up because I think even logging your food for a week can be a very eye-opening experience, particularly for people who haven't had this as an area of focus before. I mean, people typically find out that they are eating more than they thought they were, and that what
Mm-hmm.
they're eating isn't as healthy as they might have perceived, which much less how these things may tie in to certain symptoms they may be having. So it's a
Yeah,
really
there's nothing like bringing awareness, you
right.
know. Yeah.
So another area I wanted to explore with you is all the different things that you hear about, read about, are on social media, even in various journal articles, where it seems from an outside perspective as if things are flip flopping all over the place,
Mm-hmm.
or that no one knows anything about what food does or doesn't do. So I can remember, as an example, a time where coffee was something that had been identified as something that could cause pancreatic cancer. And now it is something that, if you look at the extremes that you may see on social media, will solve all of your health problems. So, can you tell me your perception of what's going on, and a way for people to think through and be more careful about what they're hearing, reading all over the place, so they don't find themselves buying into something that either will not be helpful, could be harmful, could be very expensive, and works against whatever their goals are?
Well, thank you for bringing this up. This is a favorite topic of mine, because we see so many people. There's nutrition noise everywhere. So, like you said, whether you're watching the news, you're reading an article online, you follow somebody on social media, everybody has an opinion. And for every person that says yes to caffeine, there's somebody that says no to
Mm-hmm.
caffeine, or whatever it is, a supplement, a style of eating. So there's pros and cons, and people get very divided about nutrition. They feel very passionate one way or the other. And I think the best advice that I can give people is that you need to know your own truth, do your own research, find valuable or credible resources where you're going to get your information. And to put this into context too, when you watch the news, or you have a news outlet that's reporting a new study that was just released on caffeine or whatever it happens to be,
Mm-hmm.
those studies, and you know this, Colette, from all the medical research, studies are in controlled environments, and they don't have all these. They're trying to eliminate variables so that they can get an outcome. We don't live in that type of environment. That's not the way our bodies work. They're not like that. So you have to take what we find in research, I think, especially with nutrition, and how do we apply that to real life? And I think that's media likes to grab the headline,
Exactly.
and influencers like to promote a product. So I
Exactly.
think the red flags come up when you have to take whatever comes out on the news, the media headline. You have to really think about that critically, and how does that apply to real life, and find somebody who is applying that to real life. That's something that we like to do in our business. We like to help take what's coming out in the news and, okay, what's the reality of this? What are the pros and the cons, and how do we put this in the context of, how we eat and live?
So, one of those areas that I think is definitely trending, and has been for a while, is the area of protein intake. And I think that moderation, when it comes to nutrition and eating, and in life in general, I think is kind of a guiding principle. But there are people who are touting protein as the be all end all, and at levels that may not be safe, without really communicating what the change is around the need for protein and how it might increase during the menopause journey, and why. So, can you talk a little bit about that?
Yeah, this is a great, timely topic. We get tons of questions, and you cannot go into a grocery store right now, or a convenience store,
Exactly.
without seeing protein on every
Yes.
package that is out there. And we go in waves, right? It's gluten free.
Mm-hmm.
It used to be, if you were gluten free, you would be eating whole fresh foods, and then all of a sudden gluten free became popular, and it was a weight loss diet. And there's gluten free products everywhere, and people are just eating the same food. It's just gluten free. And now the same thing is happening with protein. So we see protein, like sodas, we're seeing protein added into everything, and it's marketing. They have protein on the front of the package, and the message that is getting sent out to in masses is that we need to be consuming a lot more protein. So everybody's focused on it, but it's not necessarily the quality of the protein that we want to be consuming. And it's become more of just this big, I guess, marketing ploy for everyone to consume more protein. And when it comes down to it, protein's always been an important macronutrient. It's one of the 3 macronutrients. We know that it's essential for many functions in our body. And we know that it's important during the menopause transition for our bone health, for metabolic health, so that we can maintain a stable blood sugar. But again, we don't need to go into excess, and there's ways that you can calculate the amount of protein that you need that have been studied.
And can you talk a little bit about creatine as well?
Yeah, so that's another popular supplement, and originally that was a popular supplement way back in the day for weightlifting. And so the thought is that it can help you with muscle preservation. There's also studies now that have come out about how it can help with brain health. And I think, again, this is something that you need to sit down in all supplements, sit down with somebody who's knowledgeable about your health and figure out what is the right plan for you and whether creatine might fit into that. I'm not seeing any research that it's, that it's harmful in any way. But again, you need to look at doses. You need to look at, is it right for you? What else is going on in your body? What do you have? What kind of other health conditions do you have? And not just think because it's a supplement that it's okay to take it and to take a lot of it. So we see that happening a lot in our business too, as people are taking a lot of supplements.
Well, and one of the questions I have for you is, when you see, to the point that you had made previously, that protein is popping up everywhere on labels, I guess, for example, even Starbucks has some of their beverages are labeled as high protein. I guess for me, the question is that actually true? And there are times when something may be true, but it's true at a very high level. But when you start digging from the standpoint of the bottom line impact that it has, it may be very minimal. So can you talk a little bit about, not Starbucks specifically necessarily, but just kind of just in general?
Yeah, and I think one way to look at that, if you're curious about how much protein is in something, is to look at the label. Again, if it's available, like if you go to a Starbucks, you can probably find it online what the ingredients are in a beverage, or on a package, you can find the ingredients there. And you can see what type of protein is in there, if it's a pea protein or a whey protein, or and look at that and see what is important to you and what type of protein do you want to be consuming. This is why education is important, to make decisions for yourself, and what kinds of protein do you want to be consuming. So, and I would advise the best thing I always recommend for people too is to, again, try to go as whole foods based as possible, recognizing that not everyone can do that, and we can't do that all the time, but trying not to get your protein from like an added protein source, like into a product. Just like, say, cereal, for example, is added vitamins. They're maybe whole grain, but the vitamins are added into it. So just like that with protein, thinking about eating, meat, or you're eating quinoa that has protein, or other vegetarian sources, and getting a whole food source of that versus a processed food.
Okay. And then linked to this, I would say, are some of the diet trends that always seem to be swirling. Particularly, I think that even before menopause started to have the spotlight that it has now, people who sell products that definitely don't stand up to scrutiny jumped on the bandwagon early on, because this is always an area of interest to the general population, and at least in the United States, particularly women. So, are there any diets that are being touted now that you think, and we'll look at it from the standpoint of not necessarily just being negative diets, but things that actually are positive that people are talking about more, and that would be either helpful or really something that would not be helpful at all for women on the menopause journey?
Yeah, I think for women, they really need to find what is going to work for them and take maybe perhaps elements of a certain style of eating, I would call it, instead of a diet that is going to, again, work for them personally. What works for me and what works for you may not be the same thing. And so we need to stop comparing ourselves to our sister, our mother, our friends, and people on social media, quite frankly. There's two diets that I hear the most about for, I would say, women who are struggling going through perimenopause and menopause. And that's probably ketogenic and intermittent fasting. And that's because women are trying to lose weight generally. And I think for women in this phase of their life, they may find that it may backfire on them and they may actually gain weight. We've heard many times, like a couple will go on a ketogenic diet together and the man loses, 10 or 15 pounds in a couple of weeks and she ends up gaining weight. And it's like, what is going on here? Well, it's your hormones. And it also, I think, is a stage of life for women where they may have a lot of stress. Their cortisol level might be high. And that's when these types of diets, especially ketogenic, can backfire on you. And skipping breakfast or not getting carbohydrate in the morning may do the opposite effect. So I think these are things that women aren't aware of, and they just feel ashamed then, and they feel like nothing works for me. I don't understand it. Like, what am I doing wrong? Like they feel like they've done something wrong and they haven't. It's the way their body is working, and they need to work with it instead of against it. And unfortunately, sometimes this takes time to figure it out.
And then during the menopause journey, are there certain nutrients that people need to be focused on, maybe more so than they have in the past because of the impact of all the hormonal changes, or certain nutrient deficiencies that are actually more common than people may realize that then can also impact symptoms and long-term health?
Yes, there are some top ones that come to mind. Again, it can be individual, but common ones, I would say one is vitamin D. I think it's so important for bone health, and so many, especially in this country, so many women are deficient or suboptimal for vitamin D. And vitamin D acts like a hormone, and it's so important for so many functions in your body, including not only your bone health, but also inflammation and other things, other functions that are happening. So that's one that I always like to talk about with women. And I think, the other one in general, I would say that maybe people aren't aware of is phytonutrients. And those are nutrients in your body that have a function, they have a chemical function. So they're plant chemicals. And one class of that is what is in cruciferous vegetables, so Brussels sprouts, cauliflower, broccoli, that class of family. And those are actually detoxifying, so they can help with hormonal balance and get rid of like the bad estrogen out of your body, plus all kinds of other toxins. So I like to describe it as like sticky paper, like for flies, that would attract flies. And that's what this phytochemical does, and helps you excrete it out of your body. And so if that's really good for everyone, but I think especially for women in this stage, it can be really good to help get rid of all the toxins that we have in our body. So it's just a natural way to do that.
Okay. And then I want to circle back to what you had said earlier about muscle mass and bone density. I think that people don't realize that we start to lose that actually at the age of 30, and then it just increases from there. And when it comes to bone health, really accelerates in the first 5 to 8 years post menopause. And if you can also tie some of that in with the GLP-1 medications, which also can impact both.
Right. So I think for bone health, again, we're thinking about vitamin D, vitamin K2, because we need that to absorb vitamin D. We also need calcium, but not too much. So I always like to remind everybody about that too. And we don't want to go over 12 or 2,400 milligrams in a day. And that's kind of the maximum, because then that can interfere with other things in your body, in particular cardiovascular health. So more is not always better.
Mm-hmm.
So we've talked about vitamin D, vitamin K, calcium, and then protein. So those nutrients and macronutrient are essential for your bone health. And then, of course, the exercise component is of the utmost importance as well for your bone health. Now, related to GLP-1 use, this is a big worry of mine as GLP-1s have become so popular. We have so many women on them to lose weight. And many women are finding success, but with rapid weight loss. And just like if you had gastric bypass surgery or just had a huge weight loss on your own without a GLP-1 medication, you can have the same effects of having more rapid bone loss if you don't have the right nutrition. So it's the same concern no matter what your age is when you're taking a GLP-1, but especially when you've got kind of that double whammy with menopause. So to be really concerned and cautious about that, make sure your quality of the food that you're consuming needs to be top of mind if you're taking a GLP-1.
And they also impact your muscle mass and muscle strength as well, correct?
The nutrients.
The GLP-1 medications.
Oh, yes. Yep. The GLP-1 medications. So if you are losing muscle because of weight loss, that's why, again, you need to be focused on the nutrients that you're consuming, high quality diet, and getting, of course, enough protein.
And then are there some tips that you would give people for people who really have had the luxury of being able to eat whatever it is that they want to eat, seemingly without consequence, and how that may come to a screeching halt, but also from the standpoint of looking forward because of this increased risk of a host of chronic conditions, some changes that people can make that are simple, straightforward, actually doable, that will have an impact over time. I think it's kind of like the New Year's resolution where people try to do everything all at once, and by the end of month one, it's over and done with because they've tried to change too many things at the same time, or they've expected this miraculous improvement within 30 days, which also isn't realistic. So what are some things that people can take the time to do that will add up over time?
I think the first thing that people need to do is give themselves some grace. And then secondly, think about, kind of just sit down and do some planning and reflecting about yourself and your lifestyle, and knowing what you know about changes that could possibly make a difference for you. Like maybe it is, hey, I realized I'm not eating enough protein, or wow, I'm drinking a pot of coffee all day and it's no wonder I have hot flashes. Whatever is kind of glaring at you that you think is a doable change, start with that. Just start with one simple change. And I always think it's best to, if people can do a swap. So instead of just like, kind of ripping the carpet out and saying, I'm not doing this anymore, what could you do instead of, and do a swap. So instead of having a pot of coffee before noon, maybe you have 1 cup when you start your day, and then you switch to tea. So you do like these swaps, and once you kind of have that habit under your feet, then you can add in another one and just keep layering and layering and layering. And I would say, for another example would be, let's say you have abdominal weight gain. That's very frustrating for you. I think that's common. I mean, that was my big issue too. And really looking at your metabolic health and what is it that is impacting that. Well, like you said, Colette, when you start writing down what you're eating, you become aware of maybe some areas like, wow, I didn't realize I was eating all these kind of snacks throughout the day. I was like grazing. Well, no wonder my blood sugar is high. And I'm having abdominal weight gain. So that might be something you want to focus on. Or maybe you realize I'm having all carbohydrate for breakfast. Start adding in 25, 30 grams of protein at breakfast. So those are just simple things you can do. Another suggestion, like maybe you have high cholesterol and you want to focus on getting your cholesterol down. Maybe it's making a swap with the types of fats that you use. And instead of using seed oils or processed oils, you bring in monounsaturated fats. So those are things that help build healthy habits, one at a time.
And I personally feel, you always read that it takes 21 days to change a habit. I personally feel that within 21 days, you're just starting to begin to change the habit, and it's really more like 90 days or longer. What are your thoughts around, on average, because it's obviously going to vary from person to person, what is a realistic time frame for a person to set as an expectation for themselves so they don't kind of throw in the towel early thinking that things will have magically changed in 3 weeks?
Yeah, and I think you're right. I mean, it does vary person to person. And I would ask somebody to look at something else in their life where they've changed a habit and where had they been successful, and what was the process they went through to be successful. So, maybe it was making your bed every day, or, the day that you clean your house. When you find something that has stuck with you as a new habit, and how did you do that? And how long did it take you? And that's a good gauge for yourself, I think, to find what time frame might be realistic for you. But in what I see in clients, I would say, agree with you that for most people, like 3 weeks is probably the minimum. For most people, it's probably more. And I think I feel like a lot of times that's because people are overwhelmed and they have a lot on their plates. And I think in general, I just see a lot of people who are struggling just day to day with life that's happening, whether it's kids, caring for parents, just a lot on their plate.
And are there some simple, well, I shouldn't say simple. Well, simple in theory, not necessarily easy things that people can do, that it's not even so much necessarily about the habit, it's just making it not as easy to do something that isn't great for you. So if you know that you are going to, if you get potato chips, that you're going to eat the whole bag, just not having the potato chips in the house, period. Are there some of those type of maneuvers that you would recommend to people to make it easier? Because I think we live in a world that is set up to make it really, really easy and taste really, really good to not eat well and to not eat whole foods. So you're always kind of working against big obstacles. So what can a person do in their home environment, as an example, to make it easier or less tempting to kind of stay on track most of the time?
Yeah, I think what you said was exactly what was going in my head. It starts at the grocery store. If you buy a bag of chips, you intend to eat it. And so trying to make things easier on yourself so that you don't get put into that situation. And even simple things as if that's a temptation for you, but you still want to buy the bag of chips, maybe of some other people in your home that are eating that, is to, even bag them into individual servings and to have a rule for yourself that you never sit down with an open bag or open container. You always portion it out. And if you still feel like eating more, when you're done with that amount, you give yourself permission. You can go back and get something else. But that's just one way. If you just have a rule for yourself, I never sit down with the open bag or container and eat from it. Having even simple things like I don't eat standing up.
Mm-hmm.
And that you sit down and you set the table, or you're sitting at the counter, or you don't eat in your family room or living room. And those kind of things can be more of that mindful approach that can be helpful too. And it's not necessarily about the food, but it's becoming more conscious and more mindful about what you're eating. Okay. So it's a good relationship with food activity.
Okay. Well, and glad you brought up the relationship, because I think that the other thing that happens is there are going to be very few people who are going to eat perfectly all of the time. So if you are going to, let's say, take a detour off the healthy pathway, I think it should be a scenario where if you consciously do it and you allow yourself to actually enjoy the detour rather than eating it and then feeling guilty and regretful afterwards, because you've kind of enjoyed it, but not really. So you've almost gotten absolutely nothing out of taking the detour. And I think that particularly for people who may have had an issue with an eating disorder in the past, are in the middle of one, when the whole hormonal shift changes and everything really changes, that having a very negative relationship with food can just become that much worse. Or just for people who are trying to manage their weight. So you can talk a little bit about that.
Yeah, and I think your relationship with food is so important, and the thought around, I love what you said about, like you already have guilt before you even finish eating something, and the shame that we have around food, and giving yourself permission and that it's okay to eat something on that detour. And I feel like especially for women, because a lot of times we're judged on our weight and we think about our weight all the time, that can become a focus for us. And it's it's freeing to be able to move, I think, beyond that. And it's difficult to do. And I think one of the things that we a lot of times see too is focusing on your food, and maybe even doing food journaling can be really difficult for women, because it can be very triggering for them. Maybe because they do have a eating disorder in their past. Mm-hmm. And so I think just doing some of these simple things that can help you with your relationship with food, like I mentioned earlier. One of the other things that I like to recommend is making eating very special too. Mm-hmm. And having like a placemat and setting the table. And for me, I love having like really nice dishware and plates and making things look really nice. And that's makes the enjoyment of eating even more pleasurable when it looks really nice. And I like to plate my food so it's very pretty. And we eat with our eyes. So I think all those things can help people move beyond just maybe that immediate gratification of food.
Okay. And the couple more questions before we close. The cost of food has skyrocketed. It is often the case that food that is not good for you is much cheaper than food that is healthier. Any tips for people to help them when they go to the grocery store to eat in as healthy a way possible as their budget will allow?
really important question because food costs have gone up dramatically. I generally cook from home as much as I can and recognize, I mean, going out to eat is really expensive too. And it can seem sometimes like the food that you're buying that's more convenience related, like a frozen pizza or things that you get in the freezer section, might be more cost friendly. I'm actually going to be doing some posts on this because I've been keeping track of my food costs and what I could get in the grocery store that would be more of a convenience item. And the food, it's actually coming out where me buying the food and cooking at home is significantly cheaper. And I've been trying to be budget conscious about that too. But I think the essential part of this is having cooking skills, because that's something people lack, is having the ability to actually cook from home. And then planning. And that's another, I think, barrier for people, is it does take time to plan, but planning your meals so that you can, really work within a budget when you go to the grocery store. Mm-hmm. Interestingly, our chef, we just did a video on this, but people are migrating. What he was sharing, this is research that he has done. People are migrating from fast food restaurants to convenience stores and buying more food in convenience stores because fast food is getting too expensive.
Wow.
So that's kind of this movement, and convenience stores are responding to that to try to have more affordable food, which is another, can of worms to open too. So.
And then the last thing, it seems to me that at least for the past 5 to 6 years, the Mediterranean diet has come out on top as being number one, kind of, if you want to look broadly for most people, as being something easy to understand and follow that will be healthy when it comes to getting in the right nutrients and the positive impact that food can have on your health and well-being over a long period of time that then impacts your health span. So can you talk a little bit about that?
Yeah, the Mediterranean diet has been studied for years and years and years and continues to come out on top. It's what we use as a measure, a clinically validated tool that we measure at Launch My Health. And I think it's the reason it's so successful too is that, like you said, it is easy for people to implement. It's not a really restrictive diet like a ketogenic or intermittent fasting or other styles of eating. It's applicable to different cultures too. And that's why I think it's not just one segment of the population that can follow this diet. It's easily adaptable. And the components are very simple to follow. And I think that's what runs the test of time. I mean, I think what we're learning from all these special diets that we have is that, simple wins out. Okay. Because the best diet is the one you can follow.
Yes. So, I'm sorry, go ahead.
Oh, just that I think the most important thing with a style of eating is that you can sustain it, because you don't want to essentially run out of gas after a month and say, I can't do this anymore, and throw in the towel.
So any last pearls of wisdom or anything that you would like to share about Launch My Health before we close out?
I think, especially for your listeners who are probably in the menopausal age, that's why they're listening, that to, again, give themselves grace, and that there are reasons why things are happening in their body, and that they do have the tools that can help them with nutrition. Is nutrition going to change their estrogen level and their hormone levels? No, but it can help you weather this storm and feel better, and really help prevent chronic diseases from coming in, because that's what's going to impact their quality of life. So just know that nutrition is a tool in your toolbox, and use it wisely, and also remember that you are an individual, and what works, again, for your neighbor or somebody else, don't judge yourself on that if it doesn't work for you. Take the time be on the journey and surround yourself with people that are going to support you and help you on your health journey. And I think for Launch My Health, if people are interested in learning more about Launch My Health and the different women, in particular, women's programs that we do have one on menopause that really dives deep into nutrition. And also other segments of a woman's life when they're pregnant for fertility, and then also for women who are from puberty into perimenopause, and that we call it the cycle years. And working with nutrition and how you can support your health if you have maybe fibroid tumors or polycystic ovaries, and a variety of other things like endometriosis. So.
Okay, well, thank you again for agreeing to be a podcast guest. This has been fantastic. This area of nutrition and eating always has been a top area of interest for people in positive health programming and in other places that I have been. So we're really thrilled to have you join us today. Thank you so much.
Thank you.
We are so glad you joined us for this episode of Menopause, the Positive Way, and hope you will share this podcast with friends and family. You can subscribe to the series wherever you get your podcasts.
This is an educational podcast where the views of our guests do not necessarily reflect the views of Positive Health. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Positive Health does not provide medical advice.